Understanding hip replacement. A comprehensive guide. Hello, everyone. Welcome to our English language learning series. Today, we're going to explore the meaning of the phrase, hip replacement. This is a common medical term, and understanding it can be really useful, especially in healthcare contexts. Let's dive in. A hip replacement is a surgical procedure where a damaged or worn-out hip joint is replaced with an artificial joint. This artificial joint is often made of metal, plastic, or ceramic. The surgery is usually performed to relieve pain and improve mobility in people with hip problems, often due to arthritis or injury. The main reason for a hip replacement is to improve quality of life. It's typically considered when other treatments, like medications and physical therapy, haven't helped. The goals are to relieve pain, increase mobility, improve the function of the hip. In this section, let's break down the steps of the procedure. 1. Anesthesia. The patient is given anesthesia to ensure comfort. 2. Incision. A cut is made over the hip to access the joint. 3. Removing damaged cartilage. The damaged bone and cartilage are removed. 4. Placing the new hip. The new artificial joint is positioned. 5. Closing the incision. The cut is stitched or stapled closed. After a hip replacement, recovery and rehabilitation are crucial. Patients often need to stay in the hospital for a few days, undergo physical therapy to regain strength and mobility, follow specific care instructions to ensure a smooth recovery. I hope this video has been informative and helped you understand what a hip replacement is all about. Remember, it's a common procedure aimed at improving life quality by relieving pain and restoring mobility. Stay tuned for more videos, and keep learning.